Hey everyone, thank you for your thoughts and your prayers as I continue this healing journey. I'm glad to be home and resting up. Today I thought I'd share a bit about my experience of, the surgery and the hospital visit. It was kind of a whirlwind altogether, and some of it's still a little bit hazy, but I thought I would just share with you what happened. So I'm actually going to start with the night before the surgery. I've been studying Japanese, so I've been taking classes at Seneca, and so I had a class the night before the surgery. Had to do a presentation. Then I came home and had to basically figure out what I was going to take with me to the hospital. So the paper had recommended toiletries like soap and a toothbrush and toothpaste, pajamas, and a robe. So I packed a couple of pajamas, a robe, some slippers, toothbrush and toothpaste. I knew I wasn't going to be staying in the hospital long, so I would probably end up showering at home, so I didn't pack anything like that. Of course, made sure I had my health card, because you need that in order to go in for your surgery. I also packed a puzzle book for me to do while laying in bed, and a power bar and some things for charging my phone. So got all that done. And then as I was reading through the things that I needed to do to prepare for the surgery, I read that I wouldn't be allowed to take a bath for quite a while, sit in a tub, after the surgery for quite a while. So I decided to pamper myself that night and had a nice long bath and enjoyed it. It was a little bit hard to fall asleep, nerves and everything, so I didn't end up getting much of a sleep the night before, but I figured that the anesthesia and the rest in the hospital would make up for any lack of sleep I had that night. I had gotten a call that day saying that my surgery was going to be pushed back a bit. It was supposed to be at 7:45 in the morning, and that got moved to 9 o'clock, so I did get to have a little bit of extra sleep. Got to the hospital an hour and a half early. They wanted me there for 7:30, and it was super fast. Like, I got my mom to drop me off so that she could go get parking. Got into where the patient check-in is, was in and out in probably 5 minutes. Was told to go sit in the waiting area for where all the patients are for surgery. Sat down there for maybe, I don't know, 3-4 minutes. Got called to go change into my gown and my robe and these little booty sock things. They kind of look like hair caps for your feet with grips. Sat down for maybe another 2 minutes. They gave me a paper saying this is a kind of like a tracking number for whoever's here with you at the hospital, so that they can see what your progress is for your surgery and when you're coming out, and they'll be able to keep track of everything. My mom hadn't even really gotten through the door. She literally, as my name was getting called, she had come through to the waiting area, and when they were calling my name, it was to get ready for surgery. So I literally, as I'm walking by her, gave her the number and said bye, because I had to go and get prepped for my surgery. So that was really fast. I couldn't believe how fast it was, but that's probably because I was the first surgery of the day, at least for my surgeon. Got told that I was going to the room of awesome, so I guess it was pretty awesome, because that's where they go to numb everything so you can't feel anything. Got into the room of awesome, and they basically told me I was going to be getting a spinal tap and also some nerve blocking done. Got hooked up to an IV, so lots of needles. The nerve blocking was quite interesting, because basically they take like a needle and they stab it in your hip, and then they do it in multiple places in your hip, and then they go to the other hip and do the same thing, and it's basically just to freeze you from the waist down. You can't feel anything. The spinal tap, all I could really feel was the needle going in. Other than that, it was fine. The IV, same thing. Barely felt it. And then I had to lay there and wait in the room of awesome. So it was kind of boring. I was probably in there for half an hour, just kind of staring at the ceiling, trying to figure out what was going to be happening next. Was on the verge of falling asleep just because I was so bored just laying there. I wasn't sure if maybe there was something in the IV, but I don't think so. I think it was just a regular solution. Then once they said that I was ready, I was wheeled off to the OR. Got to see my surgeon. I think my favorite question that he asked, and one of the only questions that I remember before going under, was, "Are you ready for some instant weight loss?" Which, who isn't ready for something like that? So I remember them taking my arm, putting one arm this way, the other arm that way, putting an oxygen mask on, telling me to breathe in the oxygen. And at some point, that oxygen started to smell funny, and the next thing I know, I'm being told my surgery is done. Which I think I replied with, "No, it isn't," because it didn't feel like any time had passed from when I was getting ready for the surgery and afterwards. But you could definitely tell because I couldn't feel anything from the waist down. And they kind of go, "Can you feel this?" They're touching my leg, going, "Can you feel that? Can you move your toe?" No, I couldn't feel anything. Kind of made me think of like a Kill Bill reference of move your big toe. So I laid there for probably a good half hour. The surgery took about 2 hours, so that was really nice. That it was quick and efficient. The recovery room is pretty quiet. You just kind of lay there and you wait until they think that you're ready to move on to the next room. So half an hour of just sitting there, trying to move my toes and feeling a little helpless because I really couldn't move anything, but feeling good because painkillers were pretty strong, and which was great because I knew that they had cut me open, along the bikini lines, so I was not looking forward to that pain that would be coming afterwards. They had my room already ready for me, so as soon as I got the A-OK from the recovery room, the surgeon came and spoke to me, or my specialist, and he said, I've got pictures of your fibroids that I'll show you later. They were quite big, and we're happy to have them removed, and that everything went well for the surgery, so I'm really happy about that. I got to my recovery, or to my room that I'd be staying in at the hospital, and my mom and my sister were there waiting for me, so I was really happy to see them. Got lifted into the bed, and pretty much they were ready to give me solid food right after the surgery, which I thought was strange because I had remembered reading my post-op information, and they said, I'd be on clear liquids for the first day, so the fact that they were saying you can eat regular food was a bit strange to me. But I didn't question it, so I got myself a sandwich. So the funny thing about my sandwich was, they go, "What kind of sandwich do you want?" And I said, "Ham." And they asked what kind of bread, and I said, "On white bread." And it took a while for them to get me my food, and by the time I got it, it was turkey on brown. But at this point I was so hungry that I really didn't care. Unfortunately, the food did not stay down, so I think it was kind of a reaction from the anesthesia in my system. The food just didn't want to keep. I just wanted to basically drink liquid and sleep. But the nurses would come around quite frequently just to see how much feeling I had back in my legs, what I could move, what I couldn't move. So it was hard to get a good sleep just because they kept waking me up to check on me. But that's a good thing, and I'm really grateful for the nurses coming in so frequently to check to make sure that everything was okay. So my sister stayed, and my mom had to go back home to rest and do some work, which was fine. It was nice just to have some company there, even though I was not the greatest host at the time. But I think they knew to expect that. They had me on the IV, and I had a catheter, so I wasn't moving around, and they told me just to take it easy that day. And I had no plans of moving. I knew what had been done. Well, kind of. It was still pretty numb, so I couldn't tell exactly what had been done. It was nice to have my dad and my brother and sister-in-law come and visit me. Unfortunately, they were also around when I didn't keep my dinner, so the nurses were quite concerned that I wasn't keeping down food, so they came to check to see how I was doing. The other thing that I found was hilarious, and my favorite question that they asked was, "Are you passing gas?" I mean, most places, they don't want to know if you did or not, but if you're passing gas after surgery, that means that your bodily functions are starting to work normally again. So it's one of the few places that you can go where they actually celebrate you passing gas. So overall, the first day was pretty rough just because I couldn't really keep down food. It was pretty painful to try and cough, even though that was one of the exercises I was supposed to do. It took a while for me to be able to bend my legs enough, and they had me on almost what felt like a heating pad on my bed. And it made me quite toasty. At one point, it was uncomfortably hot. It kind of felt like staying in a sleeping bag for too long. But they couldn't move me right away because I didn't have enough strength in my legs to bend my knees so that they could roll me over to take the mat out from under me. So they had to wait a bit. When they finally did, it was the greatest feeling in the world, was having that mat out from under me, but it did not feel great bending my knees to have to roll over so that they could get the mat out from under me. So my first day was pretty rough, but by the end of the day, I was able to at least keep down jello and pudding and applesauce. So overall, I think that was a success, that at least I was keeping something down, even if it wasn't solid food. It's kind of hard to rest in a hospital because they come at like midnight to check on you and give you more medication. So they were giving me some pretty strong nausea medication through my IV just to help with the fact that I wasn't keeping down my food. And then next day, they came and they checked on me. So a lot of things happened very early in the morning. I think at about 10 to 6, my nurse came and removed the catheter. That was not a fun experience. And then my next nurse came and checked my IV and gave me some more of that nausea medication. And then a doctor and the resident came around to just check on my incision. And at that point, there was tape over my incision just to kind of keep everything in place. And they removed the tape, which was like having a really long bandage pulled off. So not so fun. And they said, oh, everything looks good. And then I didn't know what they had done for the incision. I found out at that point that they had used staples for my incision. And then they told me, oh, it'll take you about 10 to 14 days. And then you get to remove the staples yourself. And I was a little bit terrified about that because I had no idea how to remove staples from my body. So that was something that was on the back of my mind, but I was also really tired and drugged up, so I thought I'll think about that when that comes later. A little while later, I thought, actually it was pretty soon after, another nurse came and she removed my IV completely, which I thought was strange because they had just put in the IV with more nausea medication. So then the rest of the day was kind of like, they suggested, try to get up and start moving a bit. And I was like, are you crazy? Yesterday I was told not to move. It hurt so much just to do the exercises where I had to like flex my legs, bend my knees, do breathing exercises. Coughing didn't hurt as much because the tape was over the incision, so it kind of held things in place. Coughing was excruciating without the tape. So I kind of took my time with it at first. I knew that my mom was going to be coming to visit me later in the morning, so I kind of waited for her to come so that I could have somebody to help support me as I tried to get out of bed and try to use the washroom. So when she came to visit, it was quite the experience trying to get out of bed and trying to deal with the pain of the incision, and even just coordinating the bed so that it would fold up enough and be low enough for me to be able to get out was quite the experience. Overall, movement was okay. They told me, try to move a bit more, but I found that if I walked even a little bit too much, I would be in so much pain I would have to stop where I was and just let the pain course through. And then once it kind of was controllable, then I would go back to the bed. So I tried to move around, but couldn't much because it was a lot of pain. Tried to remember to do my exercises, which they get you to do quite frequently. They tell you to do it like every 5 minutes for your leg stretches. Started practicing sitting up in bed, which is very hard. You don't realize how much of your core you use until it's really hard to use it. So it was a lot of me struggling and shifting around in the bed, trying to get myself enough support through the railings on the bed to pull myself up. But I was glad that I was able to move, and I was also glad that at around lunchtime I was able to keep down the food much better, so it was nice to have solid food. And it was also nice to have family that brought me real food. Not to say that hospital food isn't real food, but food with flavor, because there's nothing more depressing than flavorless barley soup and cheese sandwich with saltless butter. My mom was nice enough to make me turkey congee, and I love turkey congee. So that was really good. It was like my favorite thing to have while I was there. Overall, the second day was pretty good. There were still times when there was lots of pain. Surprisingly, I think a lot of the pain came from the gas. So this is why passing gas is good, because the gas, when it would shift around in my body, would basically almost push from the inside against the incision, and it would be quite painful when that would happen. So I'm very grateful to have family that was there to support me and visit me and didn't mind that I passed gas in front of them. It was also really nice to have friends come and visit, and just to have attentive nurses to come. I mean, there's only so much they can do in terms of pain for me, so they gave me the medications that they could, and brought me drinks when I needed it, which was really great. So the sleep that night was pretty rough, just because it was hard for me to find a position that was comfortable to lay in, and the pain would come and go, of course. I had found a really comfortable position and was getting ready to fall asleep, and then of course the midnight nurse comes and has to come check my blood pressure and my temperature and everything like that, and then I wasn't able to find that spot again for pretty much the rest of the night until the morning nurse came and did the same thing and checked up on me. And then the resident came as well, and said, everything's looking good for your incision. We should be able to release you today. And then it was a little bit different from what he had said before, which was that I would have to remove the staples myself. He said, we talked to your surgeon, who was also my specialist. He says, call him tomorrow and make an appointment for Wednesday. We'll give you the staple removal kit, which is this thing here, and he will remove the staples for you. So I was like, oh, thank goodness. But I also found it strange because he said, it was going to be 10 to 14 days before I could remove them, and now it's been like, let's see, so Friday, Saturday, Sunday, Monday, Tuesday, Wednesday. It'll be 6 days from my surgery that I'll be getting the staples removed. So I'm not going to question it, because these staples are a little uncomfortable, and I'd rather not have them in if I don't have to, and that means that I'm healing well if they're able to take it out sooner than later. So during my whole experience at the hospital, when they said, we'll check on you and just make sure that you're ready, and then we'll discharge you today, part of me was a bit scared of being discharged because the pain was still kind of coming and going. But they said, you're mobile enough, and I actually found it very interesting. The resident said something that kind of struck with me, was that, there are different processes for healing, and part of it is a psychological aspect. And people will tend to heal better at home, where they're comfortable, and where they're, it's a little happier of a place. They can rest better. They'll tend to heal better at home than they will at the hospital. So he said, I think that your recovery process will be better once you leave the hospital. So with that in mind, I was like, okay, I think then that I'm ready. So then he gave me the discharge papers, told me I could call my parents, gave me the prescription for what I would need. So basically I'm on 2 pills of extra strength Tylenol and another medication called naproxen. So not as much medication as I thought. I thought for sure I'd be on Tylenol 3 or something like that. But it's kind of nice to know that I'm not on Tylenol 3, because that stuff is pretty strong and also tastes kind of gross. Leaves a weird aftertaste in your mouth. So by Sunday afternoon around 3 o'clock, I was able to be discharged from the hospital. And at first I thought, oh, this is going to be hard, because how am I going to walk to leave the hospital? And my mom goes, you're not walking out of here. We're going to get you a wheelchair. there's no way you could barely make it from your room to the nurse's desk without being in pain. So we're going to get you into a wheelchair. So before I was discharged, I pulled out one of my pajamas that I had packed. So it's a good thing to make sure that you pack pajamas in your bag if you do end up going to the hospital for surgery. Packed up all my stuff, got into the wheelchair, and was wheeled out. Was able to go home. Getting into the car was quite an adventure too, because my dad's car is pretty low. So the good thing is that I had both parents there to kind of help me get into the car. And it's also very helpful because my dad went through something, I'm not going to say similar, but he went through a surgery last year which was for hip replacement surgery. So he kind of understood where I was coming from in terms of pain and mobility and how to bend into the car and get out of the car. So then, yeah, that was my experience overall at the hospital. I'm really grateful for the nurses, even though I know that, like, I would sometimes complain that they wouldn't come right away, but they're very busy. They have lots of people that they have to care for. They were very patient with me in terms of my complaining about pain or being thirsty or the nausea that I was going through. And very understanding of my overall situation. I'm also really grateful for my roommates that I had in my room. So it was 2 other ladies, for the most part, stayed in the same room as me. Both of them had been in there for appendicitis. One lady was had her appendix removed from an emergency surgery, and the other lady had been re-administered to the hospital because she had gotten an infection after having her appendix removed. So they were actually quite helpful to me in terms of being able to just, encourage me in the breathing exercises, telling me not to push myself, to take my time, because they understood the pain and the incisions and everything like that. And they had a bit more mobility than me, so they were able to come if I knocked something off of my bed. So I knocked over a Kleenex box that I had, and the one lady came and was able to pick it up. And I had knocked off the remote that had the button for pressing to call the nurse, and so same thing, the other lady was able to come and pick it up. So I'm really grateful for the roommates that I had as well. I am glad to be home and resting, though I wish I did have a button that I could push to call someone to wait on me hand and foot at all times, but that's okay. I'm a bit more mobile now, so I'm able to do most things by myself, unless something falls to the floor, and then I just consider it lost until I'm able to get somebody to bend over and pick it up. I've started using the stairs and walking up and down those. I had a shower, which was great, and have been able to be a little bit more mobile. So I hope to, now that I'm feeling a bit better and in less pain, to be able to record more about my experiences and share with you my recovery process. And I will probably share with you a bit more once I know a bit more about the details of my surgery, since I haven't really been told anything other than I'm doing well, and share my experiences with getting my staples removed. And I hope to be able to share all of that with you soon. I also would like to eventually share with you how I figured out, or how I discovered that I had fibroids. And I also want to give a thanks to all of my friends and family that have come to visit, and all the emails and calls that I've gotten with support, and those who have come to offer me rides to appointments and other things as I need. And I probably will take you up on that offer at some point, one way or another. But if you are available, I would love to have company come visit. It's pretty slow during the days and the evenings, and since I'm not teaching right now, it's really slow. So yeah, I wanted to thank you again, and I'll talk to you soon. Bye.